Hi, this session is all about the female genitalia or the female reproductive system. We know we have the external and we have the external and the internal genitalia. The external genitalia of female is called as a vulva. Okay. Coming to the external genitalia, we have the vulva. So what are the procedures that can be done on the vulva? Meaning the vagina, the Bartholin glands. We have this labia majora, labia minora. When there are again localized lesions like syphilis, contagious molluscum or herpes, there can be localized formation. So those can be destroyed via cryotherapy or chemosurgery or via current like electrosurgery. So depending on the type of modality, you can assign the codes. If it is more than 15 lesions, you will go for extensive destruction. So please select your code accordingly. If there is any disease of the vulva, we can go for a vulvectomy. Right, there is something called as a hymenotomy. So usually what happens they say in a virgin, there is a membrane that covers a vaginal orifice, that is hymen. So some cases it might be a rigid hymen, so they do a procedure called as hymenotomy. But rupture of a hymen does not mean it is no longer a sign of virginity. That we should understand. In the earlier days, they were concerned if it was an intact hymen, only then the person was a virgin. But now, that being an intact hymen or not, that's not a sign of virginity. Next, coming to vulvectomy, we can see the type of procedures based on two things. One is extent of tissue that is being removed and extent of area that is being removed. Say for example, in a simple vulvectomy, they are going to remove the superficial structures, whereas in a radical, they are going to remove the deeper structures. Now, in a case of extent of area, you again divide it into, if it is less than 80%, you can go for a partial vulvectomy. If it is more than 80%, it is a complete vulvectomy. It all depends on how much of this external genitalia is being removed. Imagine if they are going to remove a 40% of the deeper tissues. 40% of the deeper tissues, then 40% will be a partial, deeper would be a radical. So this is actually a partial radical vulvectomy. Okay.